Hi, I'm Dr. Bonner with Personalized Wellness, and I appreciate you watching this video today. Today, I'm going to start this series that I talked about in my last video on cardiovascular disease and stroke, and basically what we do here at Personalized Wellness to see what your risk factors are for cardiovascular disease and stroke. But this initial video, basically I want to walk you through what happens when you first come to our clinic and the things that I do, the things that I look at. And basically, even if you never have any desire whatsoever to come and see me or come to our clinic, this would be a recommendation for you to write down and take to your family doctor or internist and say, you know, these are the things that I want tested to ascertain my risk for cardiovascular disease and stroke. So when somebody first calls our clinic to make a consult, I've changed this process multiple times over the years. I've changed the lab work that I've used, and we'll go into that on the next video. The lab work is a main criteria for this first initial visit. But what I recommend and what we do here at the clinic now is you call and you make a consult, and before you ever see me, you make an appointment to come in and get fasting lab work. So when you arrive to the clinic to get that fasting lab work, you fill out a short questionnaire, which basically gives me an idea of, you know, where you are at this point in your life with your health, as far as your allergies, the medications you're on, your past medical history, that sort of thing. Just the very basics. It basically takes 5 minutes to fill out. After you fill that out, we get your vital signs, so your blood pressure, your heart rate, your O2 saturation, to give us an idea of again, where you are at this moment in time, so we can stratify you, especially when it comes to metabolic syndrome, which we've talked in the past. Hypertension is one of the things that we look for in metabolic syndrome, and I'm a big stickler for hypertension and control of hypertension. And again, I like to see blood pressures below 120/70, but that'll be a future video also. So anyway, we get that information from you. We get you on the scales, we weigh you, we get your height, we check your body fat percentage, which is very important. But then we also take a tape measure and we measure around your waist, and we do what's called a waist to height ratio, which basically gives me an idea of visceral fat. And again, that's going to be, you know, one of the components of metabolic syndrome. I like to see that number below 0.5. So that's an easy thing you can do at home, right there, waist to height ratio, and check your blood pressure at home. So now you've got two things from metabolic syndrome that you can check on your own at home. Then the final thing we do is we get fasting lab work. Okay, so we've gone through all of this. The next video, I'm going to go into in more depth of the labs that we get and go into analyzing those labs and how that risk stratifies you. But on this video, I will give you my basic panel that we do on every single patient that comes to the clinic. Okay, so first of all, everybody gets a CBC, so that's easy, very cheap, you know, doesn't cost very much, but does give us quite a bit of information. I get a complete metabolic panel, and again, that's going to be fasting, so we will get a fasting glucose with that. The other thing that's very important with that complete metabolic panel is your liver enzymes. I pay very close attention to your liver enzymes, especially the ALT. And we'll go into that on the next video, but ALT can be a very early marker for possible fatty liver disease, which is very prevalent in our society right now. I get a uric acid level. Very important. Gives me an idea also of your diet and, you know, are you having a standard American diet? Are you taking in a lot of fructose in your diet? So that will, you know, definitely give me some insight into that. A fasting insulin. Very, very important to get a fasting insulin. We'll talk about that on the next video in more in depth. But again, this is going to help risk stratify you with metabolic syndrome. And again, I've talked about metabolic syndrome and how that impacts your cardiovascular disease risk. So fasting glucose, fasting insulin, very, very important to get. And if you don't tune into the next video, I like to see a fasting insulin below 5. So just that's a measure that you can take home and take to your doctor. Okay, so we've got a CBC, we've got a CMP, we've got a uric acid level. We're going to get a big thyroid panel, and on my thyroid panel I get TPO antibodies, I get a TSH, I get a free T3, and a total T4 level. But again, we'll go into that in more detail in the next video, but that's the basic thyroid panel that I get on all my patients. We check a vitamin D level, so that's a 25 hydroxy vitamin D level. And then finally, we check hormones. So males, we get a total testosterone level as well as a free testosterone level. Females get a total testosterone level, a free testosterone level, as well as estrogen, progesterone, and a follicle stimulating hormone level. So again, we'll go into those more in depth on the next video. I'm just giving you the basics of what we do here at Personalized Wellness. So write those things down, take them to your family doctor, but that's what we do. So essentially, once I get all of this information, and then we book a consult, you come in and I've got all of this information sitting in front of me. When I do a consult, we're able to do the consult, we're able to give you recommendations. Again, we'll talk about that later, treatment recommendations, as well as on most patients, we'll do a carotid ultrasound to check what's called a carotid intimal media thickness test. Okay, there's our basics. I appreciate you watching this video. Give us a call here at the clinic, 601-898-0911. You can also check out our YouTube video at Dr. Don Bonner, and that's where you find us on YouTube. Hit the subscribe button, that's very important. And look for our next video. Next video, we're going to talk more in depth about the lab work that we order here at Personalized Wellness. Thank you.